MRD analysis is gaining a good momentum today with the advances in techniques and in technology, with the concept of liquid biopsy, next generation sequencing. But for the time being, we should learn from what we have. We presented at ASH the update of the MRD analysis of the large FOLL12 study that enrolled 800 patients and treated, not previously treated with advanced disease. All patients were tested with a very conventional approach that was translocation BC 1418 with our qPCR or nested PCR. And at this meeting, Marco Ladetto from the Italian group presented the data about this approach, showing that both bone marrow and peripheral blood were informative, but they provided different information about the prognostic correlation between molecular response and survival. The most important results is that most of the patients respond also with the molecular deep response, with the complete molecular response around 80 to 90%, and both bone marrow and peripheral blood are informative. Bone marrow is a little bit more sensitive, it allows to detect more patients with the disease in the molecular level, but peripheral blood turns to be a very important measure, considering, however, different time points from the end of induction therapy. Peripheral blood overpasses the ability of providing data on molecular response and prognostic features associated with molecular response, starting from a later time point than the conventional end of treatment checkpoint. So starting from 6 months to 1 year after the end of therapy, detecting a molecular residual disease in the peripheral blood is highly predictive of an early relapse of the disease. These are concepts that are useful to advance the field of molecular studies of minimal residual disease that could be applied not only to the conventional techniques but also can be useful also for the more advanced and more sophisticated techniques that are available today.